can see my presentation.
Yes, you can see it.
Good.
Okay.
Okay, I want to talk you about the robotic complex in the treating oncopathological. 1 minute, I try. Okay, good. Robotic complex in the treatment of oncopathological. Robotic complex for diagnostics, risk factors, and early forms of cancer at the pre-medical stage. First of all, there is a paradoxical situation now in oncology today. On the one hand, centers with high technologies that allow for the early diagnosis of cancer to successfully treat it. On the other hand, the real situation of identifying them at the level of general medical practice. No less difficult is the diagnosis of superficial skin melanomas, in which the cure is approaching 100%. The difficulty of identifying the latter is due to their extreme diversity of patterns. To solve these problems, digital technologies and in particular artificial intelligence are increasingly developing. The purpose of the development is creation of a robotic software and hardware complex, robotic complex, to increase the effectiveness of identifying risk factors and early forms of cancer at the pre-medical stage with step-by-step training of some computer program. Material and methods of on the basis of Yaroslav Device State University and Oncodispenser developed a robotic complex including the following functions: survey of organs with illustrations, measurement of blood pressure, glucose and oxypulsometry after the introduction of personal data, examination of the skin oral cavity, zoom diagnostic up to 300 and more, using a USB microscope, staining of dangerous navy and ZR photo documentation, conducting a respiratory urease test for Helicobacter pylori called helix scan, built into the robotic complex with an optodigital converter on the screen as the main cause of stomach cancer, logistic of results for the formation of onco-risk groups, recommendations for further tactics, and their transfer online to the doctor and the issuance of a coupon. Here you can see our robotic complex. System survey with illustration and zoom diagnostic. It is performed on a touch screen with the participation of a nurse consultant on organs with a trajectory depending on gender and risk factors by type of yes or no, similar formations, sins, habits, etc. Example 1. Do you have any information on your skin? Some of them ulcer, crack, papilloma, or other. That doesn't heal for more 3 or 4 weeks. Not really. The next example, do you have a pigment spot in the eyelid, face, back, neck, sole, or other places that has become asymmetrical, has changed its edge, border, color, magnitude, diameter, so-called symptoms ABC, ABCD symptoms, yes or no? With all the answers, just click on yes or no or picture. The next one, similarly, questions and examination of the oral cavity. Yes, no, I cannot evaluate. With yes or I can't evaluate, the nurse signal to take a photo. Now you can see here in this slide the photo of some neophytes. USB microscopy of pigment elements from 300 and more with symptoms of ABCD, coloring with a special dye, and the study of structures on the robotic complex screen. The special dye penetrates through the epithelium of the skin, staining collagen fibers in red in the form of diamonds. With malignancy, the rhombosis of collagen fibers are broken, the lumps of pigments are symmetrical in the forms of bloods. The arrow shows angiogenesis. Here you can see angiogenesis and collagen fibers in the picture. Screening of melanogenic formation on robotic complex. We believe that at the stage of population screening, not to focus on the verification of individual nevi, but more important at this stage, identify individuals with neoplasms of three principal categories. The first one with low transformation, the next with melanocytic nevi for preventive measures, and the third one, melanocytic dysplasia, needing treatment. On the basis of the robotic complex, a system survey was carried out in the format yes or no of similar formations, since on all risk factors with color illustrations on the touch screen. When the patient indicated the presence of pigment moles of more than 6 millimeters prone to change, photographs were taken using a USB microscope with transmission to the robotic complex screen. In case of melanoma treating never, they were additionally painted with special dye, staining collagen fibers in bright red, normally in the form of diamonds, other structures in yellow and other colors that are violated in melanoma. Here you can see some nebuses which we painted with special dye. Calculation of the morphomicroscopic index of the degree of melanoma danger in the robotic complex is a step towards learning with the teacher of some program, neurosurgery, neurosystem. The first of all is, you can see, micromorphologic index of melanoma. The next one, number of established patterns, and number 10 is the total constant number of the main melano-operative patterns. Then you can see the table. In the table, there is 10 total constant number of the main melano-operative patterns. Some of them I can read. Asymmetry of globules, spots, stripes, dots on one side of the axis, it is 3 points if it will be in the navy. The next one, on both sides of the axis, it is 5 points. Rough brown edges or geographic map type, 3 and 5 points. The next, beige brown, red, black, 3 colors, 3 points, 4 colors, 4 points. The appearance of a gray-blue veil, 3 points. Nevus side regression, 3 points. Clumps of pigment in the form of a semi or ring cockage nevus, 3 points. Zones of violation of the rhomboidity of collagen fibers, 4 points. Angiogenesis, 5 points. And the area of scarification, bleeding, 3 points. Now you can see which is plus. It is in our picture. It is number 4, beige, brown, red, and black. Number 5, the appearance of a gray-blue veil. Number 8, zones of violation of the rhomboidity of collagen fibers. And number 9, angiogenesis. And here you can see a morphomicroscopic index. It is the formula. And next, if it up to 1, low degree of transformation, more than 1 per 1 per 2 per it's nevus with risk of high transformation, and more than 2 per 1 it's melanocytic dysplasia, suspected melanoma. Here we have a picture with 4.6, and so it is melanocytic dysplasia, suspected melanoma. The next one, in the presence of the slide test complaints and discomfort on the robotic complex from the stomach, the presence of the side test complaints. Discomfort from the stomach, the patient was invited to conduct a breath test on an empty stomach. The test was performed through a gas tube and a fitting on the front panel of the robotic complex with optodigital scanning on the screen. A basal test and with a load after taking carbamide to identify high levels the infection of the stomach with Helicobacter pylori. Preliminary results of using linear robotic complex for a targeted survey with illustration and additional its methods have shown this promise, including in the educational process. The robotic complex computer program performs the processing of symptoms marked by the patient, the formation of cancer risk groups, digital photographs, and all the results obtained taking into account the safety of leakage. Personal data is supposed to be internal online connection to the server, to the attending physician, to the doctor. The specific weight of oncorisk factors among those who applied without referral to the dispenser after examination on the robotic complex was 23 per 8 plus minus 2 per 4. It is some results. Okay, the next one. The robotic complex program interprets forms the risk of dangerous melanocytic neoplasms of the skin, recommendations, and the library of photo. You can see in this picture, it's a library of photo images for subsequent medical examination in dynamics. For example, we have a picture 1 month, the next one after 12 months, for example, and so we have some library like this. Double control and train in this recognition. Okay. The next, photo and chromomicroscopic diagnostic on the robotic complex allowed to sequester 137 patients with low transformation navy, evaluate 90 microphotos as melanoma treated in navy, and in 5 patients to be regarded as melanocytic dysplasia, and superficial melanomas requiring non-invasive follow-up examination and of treatment. To increase the statistical reliability of the test treatment, 9 superficial melanomas were included, which were admitted for surgical treatment in our dispenser, oncological dispenser, and subjected to preliminary USB chromomicroscopy. Okay, 54 patients with melanoma, melanocytic dysplasia, and high-risk navy were operated on and morphologically verified. The rest have been traced for more than 2 years. In one case, the transformation of melanocytic dysplasia with a score of 2 per 2 was not confirmed by histological examination, but it was only one case which wasn't confirmed. After modeling melanocytic dysplasia and superficial melanomas, we started the logistic of learning with the teacher, processing with the program, writing in Python using the TensorFlow 2.0 framework was machine learning, which requires further accumulation of material and step-by-step implementation into practice. Okay. The survey and examination on the robotic complex were conducted in 1,038 patients who applied to the clinic on their own, which allowed them to suspect risk factors and tumors of the skin, oral cavity, thyroid, and mammary glands, and large lymph nodes in 23 per 89 of patients. On first examination, oncopathology was confirmed in 13 patients, including with USB microscopy revealed melanomas in the horizontal grow in the first stage, horizontal grow phase in 2 patients, and melanoma treated navy in 8. The time for the survey was from 13 to 23 minutes. It is a table which you can see how many nerves we saw with low transformation 137, melanoma operose navy 90, and melanocytic dysplasia superficial melanoma it's 5. And the final clinical and morphological diagnosis you can see. Conclusion: a comprehensive survey of patients with illustrations of system on the touch screen of the robotic complex is a real breakthrough in the primary diagnosis of early forms of cancer and cancer risk groups at the pre-medical stage with the transfer of online to the doctor. The second one, Zoom diagnostic of robotic complex with magnification more than multiplicate more than 300 painted with special dye and photo allows you to detect early signs of superficial melanoma, cancer and precancerous changes in the skin oral cavity. Create a database. Then you create a database and see it in some dynamic. The use of a breathing test in the presence of the slide test complaints for the stomach and infection Helicobacter pylori above 10 units should be in indication for conducting and establishing the state of the mucosa. The obtained results suggest the need to produce and explain the use of robotic complex in lean polyclinics, saving the doctor's time on average 15 plus minus 4 minutes per patient. Prospects for the application of the robotic complex are associated with the serial production of the robotic complex and further training of the some program in it. Okay, thank you for attention. If you have question, please, I can ask, I think. Thank you for attention.
Thank you very much, Dr. Maria Reis. Thank you very much for your sharing. Is there any questions? Any question to ask Dr. Maria Reis? I think there's no question, Doctor. Thank you very much.
Thank you. Okay. Thank you.
Okay. Now I'd like to